I get asked all the time what kind of plastics I use in plastic surgery. The answer is none. The plastic in plastic surgery actually comes from the Greek word plasticos, which means to shape or to mold. Plastic surgeons shape or mold tissue. We spend our entire surgical training learning how to manipulate tissue, whether it's with a scalpel, a syringe, or a laser. Surgical techniques and principles that we learn apply equally to cosmetic or reconstructive surgery. There are those who would have you believe that cosmetic surgery is a unique surgical discipline, but that's disingenuous at best and misleading at worst. To put it simply, it's not true. The distinction between cosmetic and reconstructive surgery is largely an artificial one initiated by the insurance industry to determine what was a covered benefit. You have to remember, insurance companies are in business to make money, not necessarily to take care of you. If your needs are met, you can consider that a bonus. Now, cosmetic surgery has traditionally been called surgery on normal body parts and therefore not covered by insurance. Whereas reconstructive surgery is surgery on, quote, abnormal body parts and therefore a covered benefit. But try telling a boy with B-cup breasts or a girl with dumbo-like lop ears who are both getting teased horribly by their classmates that their conditions are cosmetic, whereas their grandmother's sagging eyelids are considered reconstructive. The surgical principles and techniques that go into lifting a sagging breast, not a covered benefit, are the same ones used in reducing a large breast, a covered benefit, at least for now. There are insurance plans out there now that no longer offer breast reduction as a covered benefit. Now try telling a woman with 38 double D breasts who has chronic neck pain, back pain, shoulder pain, she gets heat rashes, she can't exercise, and can't find a comfortable bra that her condition is cosmetic. How can this be? Well, by and large, insurance companies are run largely by men and entirely for profit. And so they make more by spending less, and that's how they exclude certain procedures from being covered. Putting a face back together after a car accident and rejuvenating a face require the same knowledge of anatomy and principles of tissue manipulation. Plastic surgery is more than abnormal versus normal. It's about making people feel better about themselves. People often ask me why I went into plastic surgery. And during my training, all residents rotate through various surgical fields. And most of the surgery was bucket surgery. You were cutting something out and throwing it into a bucket. And really, no one wanted that surgery. They all were getting it because, well, it was the thing they had to have done. What I noticed in plastic surgery is everyone was looking forward to that because the plastic surgeon was either going to fix something or make it better. And it was that whole atmosphere of positivity that attracted me to the field. I get asked a lot, like, what my favorite procedure is, and quite honestly, my answer is always the same. Whatever is the procedure that makes somebody happy. As we're going to see in our next episode, all plastic surgeons are cosmetic surgeons, but not all cosmetic surgeons are plastic surgeons.